You come into the clinic on Monday morning. 3 surgeons are asking for their consultation notes, insurance eligibility hasn't been verified for the week's appointments, and a weekend's worth of faxes is stacking up on the desk. When an office manager starts drowning in that exact mix of paperwork, it feels like a localized crisis. But zooming out to look at the industry data reveals a systemic failure in how medical practices are staffed. This diagram tracks the pressure building across the industry. According to the Medical Group Management Association, front office support staff hit a 40% turnover rate in 2022. And right alongside that, AMA data points to 63% of physicians reporting administrative burnout. Every time one of those front office positions turns over, the financial damage compounds. MGMA benchmarks show it costs between $9,000 and $12,000 to replace a single hire. If a practice cycles through 2 or 3 people in a year, the training costs alone can cripple a small office. Surgical practices are hit the hardest by this cycle. Processing complex pre-op documentation, routing pathology reports, and verifying procedure benefits requires a highly specific, trained skill set that is increasingly difficult to find in the local labor market. That exact pressure cooker was the daily reality at Advanced Surgical Physicians in Wellington, Florida. Their office manager, Eileen Shapiro, was wearing 2 hats at once: office manager and surgical coordinator. Every single day, Eileen was trying to manage 3 relentless bottlenecks entirely by herself, processing an endless volume of incoming faxes, running insurance eligibility checks before every appointment, and updating the consultation notes for all 3 busy surgeons. When you try to patch that level of specialized, high-volume workflow with temporary, generalized in-house hires, you end up locked in a cycle of training, turnover, and operational backlog. In October 2024, Advanced Surgical Physicians broke that cycle. Instead of posting another local job listing, they brought on a specialized virtual medical assistant through Staffingly. This was a highly targeted placement. Staffingly only places candidates with a healthcare administration background, and their entire operation is HIPAA certified, SOC Type 2 compliant, and HITRUS certified. Instead of rotating temps who never learn the system, Staffingly connects the clinic to one dedicated professional who learns their workflow. To ensure stability, a supervisor node provides ongoing accountability, creating a permanent operational partnership. Virtual staffing resolves the admin crisis when the remote worker is fully integrated into a clinic's existing electronic health records and daily rhythms. Once integrated, the VA took over the incoming fax queue. By sorting and routing documents directly in the system, they prevented the clinical team from having to chase lost paperwork. Insurance eligibility shifted from a reactive scramble to a proactive system. The VA began verifying coverage for every patient well before they walked through the door. And the consultation notes workflow was restored. All 3 surgeons received accurate updates in the system without having to wait for the office manager to find a gap in her schedule. There was a normal learning curve as the assistant adapted to the clinic's specific tools. In December 2024, Eileen noted that things were moving in a positive direction as the VA learned the practice's daily nuances. By February 2025, that adaptation period was complete. Eileen reported that the VA was highly responsive to feedback and had become an indispensable part of their team. Offloading high-volume data tasks cleared the front desk bottleneck. It allowed the office manager to focus on managing the practice instead of surviving the paperwork. The operational state at Advanced Surgical Physicians changed. Faxes were processed daily, providers were supported, and the front office was stabilized. This chart breaks down the financial math. The practice stabilized their workflow for roughly 70% less than an in-house hire. A full-time local hire runs between $35,000 and $45,000 a year. Compare that against a dedicated Staffingly VA, starting at $8 an hour. After 12 months of continuous service, the proof of reliability was public. In November 2025, Eileen left a verified 5-star review, praising the reliable, efficient service and their wonderful remote team member. Combining specialized healthcare training with radically lower overhead ultimately solves the structural math problem facing surgical practice administration. If your office manager is currently spending half their day on faxes and eligibility checks, your practice is carrying an unnecessary burden. Staffingly offers a low-risk way to fix that. They run a 2-week risk-free pilot on a month-to-month basis with no long-term contracts or overhead. You can book a 15-minute strategy call at staffingly.com.